Yes, it feels good to be here again. Yes, it feels very, very wonderful to know that you're also there just to learn, just to hear, just to improve medically. Because the name of the program self, now Health Matta. You know, the person will get health, now you get everything. Because our people talk, say, what be the essence of money? Where person no get good health to enjoy am. That's why we carry Ogbonge man with Sabi. I'm talking about a certified doctor, certified medical practitioner, the CEO, Grace Valley Hospital, a man that is also a general consultant, Dr. Bartholomew Ofegbolam. Good morning, sir.
Thank you very much, Chief.
You're welcome, sir.
I'm happy to be back.
Happy
Good
to
to
have
have
you.
you back.
Good morning,
Sir. Good morning.
You're
Good
looking lovely.
Thank you, sir. Trying to be
With
like
a
you.
nice hairdo.
Thank you.
As always.
Thank you, sir.
Yeah.
So, doctor, before the vacuum, we were actually talking about female infertility.
Yes.
But we want to beseech you, want to beg you, sir, if you can help us, let us take it TOP, like we say in production. Let's take from the top again. Let's recapitulate.
recap.
Thank you very much.
Please.
Yeah, good morning to our Nigerian and global audience. This morning we're happy to be back on our regular weekly health talk show, talking about health matter. Okay, so this morning we'll be taking off from where we stopped a fortnight ago. Female infertility. Female infertility. It is a very big topic globally. I can tell you this because oftentimes a lot of social stigma are attached to female infertility, and oftentimes too the blame is put at the doorstep of the women, even in situations where a man could be the infertile partner in such a relationship. All over the world, infertility is estimated to affect about 48 million women. Okay, that's a rough estimate. 1 out of every 6 couples have challenges with infertility. 1 out of every 6 couples. Now, what is infertility all about? Infertility is the inability of a non-contraceptive couple to achieve pregnancy over a period of 1 month with adequate sexual exposure. Okay, adequacy in sexual exposure, we've talked about it, sexual intercourse of nothing less than 3 times in 1 week. Okay, but if the challenges or the problems are traceable to the female, we refer to that as female infertility. And some studies say that it contributes to about 50% of infertility challenges that we have. But on its own, alone, female infertility contributes about 1/3 of challenges with infertility. Okay, so this morning we'll be looking at female infertility under a number of headings. Number 1, what are the types of infertility?
Okay.
What causes infertility? Okay, how is this problem diagnosed? What are the risk factors, if any? Are there prevention that can be done? And then if we have all the time, we could go as far as treatment. So we'll start by types of infertility. Majorly, there are 2 types of infertility. Number 1 is in a situation where a couple have not been able to achieve pregnancy and carry the pregnancy up to a live birth. Okay, we can be looking at primary infertility.
Okay.
It doesn't matter if the couple have been able to achieve conception. Once it does not result in a live birth, if it ends in a miscarriage, in a stillbirth, it's still regarded from WHO definition as
infertility.
Yes, as primary infertility. Now, but secondary infertility is in a situation where a couple who previously have been able to achieve conception that was carried to a live birth are unable to achieve subsequent pregnancy. Okay? That is secondary infertility.
Okay.
Now, there are causes of infertility, and I want to also look at them from a number of classification.
Okay.
Number 1 is genetic. It could be genetic, and it can also be acquired.
Okay.
Okay, that's one form of classification. Another classification has to do with the location of the problems or the challenges that may be responsible for infertility. Okay, when we are talking about acquired causes, we are looking at a number of causes like age. Okay.
Acquired causes?
Yes, of course. Age. Your age keeps increasing. Okay, so we are now acquired causes now. We are looking at age. We are looking at infections, usually sexually transmitted infections. We are looking at weight-related problems. It could be underweight. It could also be overweight. Okay. Now, talking about age, we all know that a woman's age begins to decline over time or with age. Now, a woman is at her peak when she's in her early 20s and mid 20s. From 27 years of age up to 30, a declining starts to occur. Oftentimes going as far as, by the time the woman adds another decade, of course, is the declining is a little bit faster. Okay. Now, age too. When we talk about age, I want us to look at so what we refer to as in medicine as menarche. Menarche is simply the age at which a woman started seeing her menses.
Okay.
Usually, the average age at which a woman begins to see her menses usually hovers from 12 to 13 years.
Okay.
Globally. Okay, but that's not to say that there may not be situations where it could be less than that. Okay, the earliest menarche that has been recorded in history was said to be at about 5 years of age.
Wow.
Recently in Nigeria, we heard about, we read a story of a little girl who became pregnant
10
at the
years,
age of
yes,
10.
yes.
Okay, so, and that can happen. Okay, but averagely, 12 to 30 years of age is when usually the menarche will begin. The menarche, like I said at the beginning, is the woman's first period. Okay. Now, as it progresses with age, there will be a decline as the person gets to age 35 and beyond. Okay, so it's one of the causes of infertility, especially in female. Another cause has to do with weight. Whether it is overweight.
Underacquired.
Yes, underacquired. Whether it is overweight or underweight, it actually causes a lot of challenges with fertility. Now, I will say this, that I'll make this point. Usually, for people who are overweight, the adipose tissue also plays a role.
The what, sir?
Adipose tissue, fat cells.
Okay.
They also play a role in the production of some certain hormones, that are very key in the reproductive cycle of a woman, talking about estrogen. Okay, so if you have too many fat cells, other than that, the gonads are actually the ones that are responsible. Ovaries are actually the ones that are responsible in the production of this hormone. But fat cells too do produce this hormone, however, in little quantity. So, but if one is too fat, that means technically the person will have an excessive production of this hormone, estrogen. And of course, the body sometimes could read it as having a form of contraception. So it inhibits the person. Such people may have challenges with menstrual cycles and, of course, ovulation. And, of course, invariably getting pregnant. Okay, so by the same token, if you're also underweight, there is a certain percentage of weight that is considered to be below normal. If one is also underweight, as can be found in some athletes who have low percentage of body fat, that can also...
Because they're always very skinny. We find that most of them don't even have breast and everything.
Always flat.
Okay, so that also can pose some challenges because they will have too little adipose tissue adding to the production of estrogen that usually will help. So they may have challenges with irregular cycles as well as challenges with ovulation. Irregular ovulation in some cases. Okay, so challenges of weight, we'll look at specific topics like anorexia. Okay, anorexia nervosa is a situation where one is a form of eating disorder, in which case a woman may have challenges with compulsive and excessive desire to lose weight. Okay, so oftentimes
they say that the diet.
Yes, oftentimes that creates challenges that brings about a number of problems that can affect a woman's fertility. Bulimia too can happen, but bulimia, the difference between the two is that anorexia nervosa is more or less a psychological problem.
Okay.
Bulimia, in the case of bulimia, there's excessive compulsive
Loss of weight.
no, not loss of weight now. There's excessive compulsive desire
To increase.
Okay,
and
to eat.
eat.
Oh,
To eat.
Okay, but at the
okay,
same
other
time,
one is you
no, I'm
shedding.
coming.
Okay.
No, at the same
Okay.
time, they also make an attempt by inducing purging so that they can equally lose the weight.
Oh.
So the difference is that anorexia nervosa, you almost always will have a weight loss problem.
Okay.
But
Because
in
you want to
bulimia,
diet.
yes, in bulimia, they may not necessarily be, the person may have normal weight or even overweight. Okay, so these are some of challenges that can come with weight.
Okay, Dr. Bad, before we go on, you made mention of some things that actually caught my attention here when you were talking about age anarchy and the menstrual cycle and some other stuff. We've seen some young ladies who are actually taking pills. Let me use that in quotes now. Young ladies who are not married now who are taking pills not to be pregnant and are having sexual intercourse.
Contraceptives.
Not contraceptives now, pills. I think you know what I'm saying. Not in form of a contract.
Okay.
Well, it's a contraceptive anyway, but the family circle.
Okay.
the,
Like them doing family planning before even
Thank
getting
you.
married.
Family
Okay.
planning.
Okay.
Let me be specific. Does this have
Aye.
anything to do with infertility? A
Like
young girl,
later on.
when she's ready.
Okay.
A young girl who is not married but is exposed to sexual intercourse and is on family planning program. Can this lead to infertility?
The answer for me should be, thank you for that question. It's a medical one, I must point out. The answer for me should be a yes and a no, and I will explain the reasons.
Okay.
Now, if someone is desirous of becoming pregnant and is somehow delayed, of course, there is a problem. Okay, so some of these hormonal contraceptive pills that we take or that women take can actually delay one's fertility for some time, even beyond what you may find, what one may find in such literature for such pills. Okay, so I've seen a situation where a patient of mine who was on a 3-monthly injection, contraceptive. Okay, usually when you take the first injection, it will prevent you from becoming pregnant for at least 13 weeks. Okay, now, but after the 13 weeks, when you don't take the next one, your fertility is expected to return over time. But sometimes it could get unduly delayed for up to a year. And of course, the woman became worried. So for such a woman, she's having challenges with infertility. But however, I will end up by saying that it can be reversible over time.
Okay.
In most cases, it is reversible. Okay, so that's all I can say. That's why I have to give that answer. Now, the next topic I would like to talk about is tobacco smoking, still underacquired.
Yes.
Okay,
Yes.
now,
To that for one fan in a week or something.
yes. Now, tobacco smoking generally affects infertility in women in a number of ways. Number one is that the nicotine that some of these cigarettes contain, okay, can impact negatively on the blood flow in the uterus. That's talking about the womb. It can also affect folliculogenesis, development of follicles, eggs that usually the woman will shed on monthly basis that we refer to as ovulation. Okay, so it can also affect implantation in a situation where fertilization has occurred. Okay, so usually fertilization will occur at the fimbria of the fallopian tube, and then when fertilization occurs, the zygote will begin to track down through the tube, through the ovarian, through the fallopian tube. I beg your pardon. It will start tracking down through the fallopian tube. Okay, until it gets to the womb, and then it implants, and then the baby will begin to grow. Okay, so not just people who are exposed to smoking, not just people who themselves smoke, people who are exposed to smoke-filled environments could also have this. Yes, it's not
passive
until
smokers now.
passive smokers.
But Dr. Batsa, sorry to hold you because we'll soon go on this break. If you talk about tobacco smoking, which carries nicotine, that's nicotinous substances now, how about a woman who is addicted to coffee and she doesn't see it as anything? She's looking for how to be fertile, she wants to be pregnant, but she still takes a normal coffee, not decaffeinated now, or say some of these tea bags. The caffeine there, is it huge enough to stop fertility?
Thank you very much for that question.
You're welcome, sir.
Yeah, the coffee, the issue of coffee, there seems to be no agreement on whether it actually plays a role or affects infertility or not in terms of coffee and caffeine. Okay, so there are different school of thoughts. There are some people who believe it does not have anything to do. Some people believe it has something to do with it. Okay, so that's all I can say on that.
So, and that's where we are going to let you take a short break so that we'll go on this shikini break. Health Matter. We'll be right back. Thank you very much, Dr. Bat. We will be right back.
Health matter na serious matter o. That na why we dey always get Dr. Bat Ufegbunam every Saturday to come teach us and enlighten us on top with health matter. You fit also advertise your product and services on top with show where dey help people. Terms and conditions apply sha o.
For advert placement and sponsorship, make una call Stella Maris on top 070 3914 5229. Rebecca 070 6969 1950.
Yes, you're welcome back to the show Health Matter, and we still discuss female infertility. Yes, a little rundown of what Dr. Bat don't make us realize. He said 48 million women in the world and they suffer infertility. 1 out of every 6 couple and they suffer this issue of infertility. Make us realize say 2 different major types of infertility now in day. Say primary infertility day, secondary infertility also day, and it don't make us realize the causes that is genetic and acquired. So if you just join us, you know to miss. I must stay back, relax, get a pen, get a paper, then you can get your phone so that you can make calls too, because phone lines will be open now so that you can ask anything where we say they do in yaga for mind as far as this theme of discussion is concerned. Our phone lines are open.
Yeah. Okay, so the numbers are opened. Guys, feel free to talk to us. I beg 08105434985 and of course 08173147589. Just help us cue your TV volume so that we fit take your calls.
You're on tobacco smoking, sir?
Yes, still on tobacco smoking. Females who smoke are 60% more likely to be infertile. Up to that.
60%.
Or more likely to be infertile than non-smokers. Okay, still on smoking too. Females who smoke have about 34% chances of having failure when they go for IVF than people who do not smoke. Wow. Females who smoke too have about 30% chances, even when the IVF has succeeded, of having such a pregnancy ending up in a miscarriage. Okay, so smoking does a lot of havoc when it comes to infertility and when it comes to especially female infertility.
Okay, sorry, sir. We have Musa from Gombe. Musa, good morning.
Hello?
Good morning, Musa. Good morning, Musa.
Yeah, good morning, sir.
Yeah, good morning, my brother.
I want to ask the doctor. He's highlighting on the causes of infertility. He make mention of nicotine. Nicotine, that if a woman she's staying a place where smokers are smoking, if she perceives the smoke, it will cause infertility. Then there is some drinks like, is it Coke? There are some drinks that consist of nicotine, and some women are being adapted to it. Like there is one woman I know, she's adapted to Coke. This causes infertility, and she's having an issue with Coke. Then there is a day that I make a research concerning these drinks, like they say there is some percentage of nicotine. How true it is? Thank you, doctor.
Thank you very much. I think thank you very much for that
wonderful
question.
We'll actually shy away from brand names, but soft drink that contains nicotine now.
I'm not sure any soft drink contains nicotine.
Or is he talking about energy drink?
What we have is drinks. I'm sure a biochemist will help us further on this.
Yes.
I'm not sure if any soft drink contains nicotine. I think nicotine is only found in cigarettes. Okay, but that said, any substances that we consume that contain nicotine, whether coming from smoking or some other sources, should there be any, of course, the same rule should apply, or the same effects will be gotten when one indulges in any of that.
So it's
okay?
a simple law of garbage in, garbage out.
Yes. So that's all I have to say on that. And still on this smoking too, females too who smoke have higher chances of reaching menopause by 1 to 4 years than non-female smokers.
Whoa,
Hitting
that's
early menopause,
deep.
1 to 4 years than people who do not smoke.
That's deep.
Okay, so still unacquired, I'd like to talk about sexually transmitted diseases. Okay, so sexually transmitted diseases or infections are said to be one of the leading causes of female infertility. Oftentimes, people who have had chlamydia in time past that was not well treated, people who have had gonorrhea in time past that was not well treated, many years down the line, it could also affect their tubes and can cause tuber blockage. Okay, we'll still get to that when we start talking about location.
Does stress have anything to do with infertility?
Yes, stress has a role to play. It affects the also, apart from the physical causes we are mentioning, and there's also psychological causes. Okay, so we've said a number of that when we talked about even erectile dysfunction for males. So it has a role to play. And then body weight, will dwell on that. Other causes are radiation. Now, radiation has to do with a form of treatment for people who have one form of cancer or the other. Usually, it emits some form of rays that are used to try to kill the fast-growing cancer cells. And in so doing, what happens is that those fast-growing cells in the body, cancer cells are usually fast-growing. And for you to be able to kill them, you need something that will be as fast as that. Nike from Lagos. Nike, good morning.
Hello, good morning.
Yeah,
Good morning,
my
Nike.
sister.
How you doing?
Yeah. Please, doctor, someone that has infection and you are not discharging from the, I'm not discharging, but when I run the test, they say I have infection and I'm trying to keep for past 3 years. So how come that officer don't understand?
Nike, you have to take that again. We can't
yeah.
really get you. Please take that again.
And I was running a test. The test said that I have infection, but I don't discharge. I'm not feeling any discharge from
Okay.
She actually ran a test, and
She's still there. So what's the problem? You were told you have an infection, but you're not seeing any discharge.
I think that was
Okay. The much we got, she ran a test.
Nike, you did there?
Can you turn down your TV volume, Nike?
Yes.
Turn it down, please.
Nike, when you run the test, you don't see any discharge, but the test say you get infection.
Yes.
Okay, so what's the problem now?
Did it prevent you from becoming pregnant?
The volume is loud.
Yeah. Okay.
Okay, I think this is what we'll do. Nike, Dr. Bat's
Number.
number will be displayed on the screen. You can have a one-on-one with him after the show. His profile will be displayed, so you can both. But what?
But at least you can see the.
Yeah, it's not all the time that you have an infection that it could present with a vaginal discharge. Of course, depending on the aspect of the female reproductive organ that is affected by the infection. Sometimes you could have a pelvic inflammatory disease. Of course, pelvic inflammatory disease are diseases that usually affect the cervix, the uterus, as well as the tubes, fallopian tubes. So depending on the location of oftentimes you may not have a physical discharge, and the indication that you're having, you may do an ultrasound and they could discover that you have fluid collection in your pouch of Douglas, sometimes referred to as cul-de-sac. Okay, so a doctor sees it and interprets it as an indication that such a person may be having a PID. Okay, so such a person may be subjected to some further tests to actually find out what type of infection, and of course have the person treated, which is very important. Okay, so we're talking about radiation, and I was trying to say that usually cancer cells in the bodies are usually very fast growing cells, and now for you to be able to match them, you need a treatment mechanism that will be going at about the same rate. Okay, so what happens in radiation is that those cells of the body that are also fast dividing, just like the cancer cells, okay, that the radiation affects them. And what are these organs of the body? Organs like gonads, okay, the same happens with chemotherapy as well, which is a form of cancer treatment. So
yeah.
you discover that people who undergo such treatment, oftentimes the hairs too are fast growing, so they will start losing, they will start having hair loss. Okay, it can happen. And then their testes, if a person is a male, the testicles could get affected. Okay, so what I'm saying is that it causes what we refer to as the toxicity that it creates affects the gonadotoxicity or gonadatoxicity. In the female, it could also kill the eggs, some of the egg or all of the egg, and eventually such a person may end up with infertility. In developed countries of the world, usually before somebody embarks on such a treatment, usually they can do freezing of such a person's egg. Okay. Or even a fertilized zygote can also be frozen too. Okay, so that much later, at the end of the treatment, when everything must have resolved, such a person could still have an opportunity of becoming a mother, or can get a surrogate that can actually bring forth an offspring that the person will call his or hers. Okay, so chemotherapy too can affect that. We have talked about that. Cancers too, generally too, can give you such a picture, can affect and cause damage.
We have Suoyo from Bayelsa. Suoyo, good morning.
Good morning.
Good morning,
How are you doing, sir?
Fine, sir.
Please go on.
Go on with your question, please.
Yeah, good morning.
Good morning, my brother.
Fine. I'm enjoying this program. It's very important.
Thank you,
sir.
Something I want to complain.
Thank you.
Yeah, you know this WAP TV, we used to enjoy because of the English, sometimes the way you break it down, but the doctor is not breaking it down very well. The grammar is using is, I believe he said, you should bring it down, please.
Okay,
you know
thank you.
there are some things that
it's
in a medical name, not the way if you do. Person won't cause chlamydia now. Wait till be the pidgin for chlamydia. So you just have to bear with us on that. Now medical names, please.
Thank you very much. I will make conscious effort. It's important.
So you could know pidgin.
I will make conscious effort. The ones I can break down, I promise I will do that, sir. Thank you very much. Because the one I'm going to talk about next, I'm trying to see how I will break it down.
How you talk genetic for pidgin?
Yes, so immune infertility. This one now, don't get, if I break out, even doctors, colleagues that are listening to me will also not understand what the person is talking about. So sorry about that, but I'll make a conscious effort to do that. Yes, immune infertility. Okay, so anti-sperm antibodies, ASA for short, anti-sperm antibodies. Okay, usually you have that attacking the what happens in anti-sperm antibodies, I'm trying to break it down like he requested, is that you have a problem that affects the movement of the sperm in the body of the female, in the female reproductive organ. Okay? So these anti-sperm antibodies, they usually attack the surface antigens on the surface of the sperm. Okay, so what happens is that in a situation where a man gets exposed to a woman, talking about coital exposure now, and then the sperm that has gone into the body of a woman is incapacitated, in the sense that a number of things that actually should happen for there to be fertilization will be hindered. Okay, so the acrosome reaction that usually would take place will not be able to happen because of these anti-sperm antibodies. And this can be caused by a number of infections in the body of a woman. It can be caused by non-vaginal sexual exposure in some female. It could be anal exposure, it could be oral exposure. Such can actually bring about the formation of these anti-sperm antibodies. So it's also a form of it can also cause infertility because number one, it hinders the motility, the movement of the sperm in the female body. And when it gets there, to fertilize the egg becomes a problem. Okay, so now other causes that I would like to look at is adhesions, which could occur as a result of surgeries. People who have had pelvic surgeries in time past, they could have adhesions. Now, what these adhesions are all about is because of the trauma that the surgery brought about, the body tries to repair itself. In so doing, some parts of the body pelvic organ gets to be matted together, okay, as a result of surgeries. People who have done cesarean section before,
I was about to ask.
yes, and are going back for the second. For doctors, we usually see that when a woman must have been exposed to one surgery or the other. So if you have a woman who has probably done cesarean section once, the degree of adhesion you will encounter when you go back a second time will not be as much as the one you will encounter when you're going in for somebody who probably has had a fourth or a third cesarean section. Okay, so it makes it difficult, and that can actually cause infertility.
Just to ask, sir, it's a domestic fallacy, but I just need you to clear it. You know, say most times when we dey outside like this, we dey talk some things. So everybody na doctor. Until we come meet una, we know all of us na doctor. You will see some women, they will say, if person don't do CS 2 times, you know, if he get belle the 3rd time, if he get am, na risk, he won't kill himself. I'm coming to that, sir. Matthew, good morning.
Sir?
How you doing, sir?
Very well, sir.
Okay, our doctor is here. You can go ahead with your question or...
Good morning, Matthew.
Good morning, doctor.
Yeah, good morning, sir.
I want to ask. Very well. Hello, can you hear me?
Go ahead.
Yeah,
please.
go ahead, sir.
Okay, I want to ask that does low immunity, does it have anything to do with infertility?
Low immunity.
Yes, but not directly. You can see it took me a while
it took you a while to respond.
to reason it out. Yes, sir, it can, but not directly. I will tell you the reasons. Low immunity. If somebody has a low immunity, it could be as a result of a pre-existing medical condition in such a person. It could be as a result of diabetes. It could be as a result of HIV/AIDS in such a person. So if you have low immunity, it exposes the body to opportunistic infections, okay, which can actually ordinarily our body defense mechanisms are equipped to fight some of this infection, to ward off this infection, so that we don't come down with the disease. But in a situation where one has low immunity arising from a pre-existing medical condition, it exposes the body to all sorts of infection, usually referred to as opportunistic infection. And chronic illnesses have been implicated, like chronic illnesses affecting the liver, affecting the kidneys have also been implicated as causes of infertility. So not directly, but indirectly it will get there. Thank you very much, sir, for that question.
You were on adhesion, sir.
Adhesions,
yes.
Arising from previous history of surgeries.
The question I ask is just to hear from the horse's mouth. Is it true that when a woman has gone through cesarean section the first time, the second time, she should not bother getting pregnant the 3rd time, or there are medical integrations now that can make you go the 3rd or 4th birth?
We have someone from Bauchi.
Okay, Abana.
Yeah.
Good morning, sir.
Morning, sir.
How you doing?
I don't find no.
Okay, our doctor there.
Yeah. Morning, sir.
Good morning, my brother.
Right, sir. Okay. Doctor, I want to ask some questions.
Please go ahead.
There's a problem. A woman that did CS during the time of delivery. During the time of delivery, the woman did this CS. So she's done. She's not been seen her menstrual cycle for almost 12 years at least. Is there any way to solve the problem?
Thank you very much for that very important question. Thank you very much for that very important question. In fact, the question you asked has something to do directly with what we are talking about now. I've also seen a colleague of mine in one of the hospitals where I worked many years ago. I should be over 12 years now. They got married. The wife was working in the bank. The husband was an MO, medical officer. And then she went for fibroid surgery. Fibroid surgery is just equivalent to cesarean section because it's same pattern that are used for both surgeries. You have to enter the substance of the womb to actually get a fibroid or to remove the baby. So both are considered the same. If someone has had a fibroid surgery and is going for a cesarean section, we will regard the fibroid surgery, myomectomy, as one previous years, equivalent to one previous years. Okay, so but this couple, soon after the surgery, they've been trying all sorts and they couldn't achieve conception. Okay, so one of the treatment option that was given to the woman, to the wife, was adhesiolysis, trying to break down the adhesions that arose from that previous surgery that was done. Okay, so that could happen in a case, in the picture you just painted. Maybe, just maybe, because you said the woman wasn't seeing her period again. Okay, so what could have happened is that adhesions may have taken over, may have affected the substance of the womb. The uterus usually has the epithelial covering, the inner covering of the uterus, have several layers that usually are responsible for menstruation. Okay, so sometimes too, you could have, when D&C, dilatation and curettage, was popular, people who go for D&C oftentimes will end up with such a challenge. When you have overzealous curettage, when you scratch deeper and deeper into such layers that are responsible for menses, at the end of the day, the patient will come down with, yes, you'll be able to
scrap the surface.
To damage the
rough surface.
To damage that aspect of the womb that are actually responsible for menstruation and implantation and all that. So what you have is the body does not allow for vacuum. The body will try to regroup and then readjust itself, and it will end up producing adhesions, which will impact negatively on menstruation. So that we can see in a condition known as uterine synechia or Asherman syndrome. So that can happen. That may be the picture that has happened for this woman. So such a woman may be a good candidate for a laparoscopic procedure. We'll talk more on that when we get to treatment. Okay.
So 12 years, like the man asked, she has not seen her menstrual cycle. Is there any miracle that can still happen medically for her to see it?
Depend on the age. On the age of the woman. Okay, so it depends on the age of the woman. She could also benefit from IVF and a number of other treatment options, depending on what could be the picture.
How about the issue of 2-3 CS thing that we carry about? Is it true? Chances.
Yes, usually it's an individual thing, but sometimes we advise as doctors, you can only advise, okay, but the people concerned will still go ahead and do their thing. It is just to advise, it's theirs to do their thing. I've also seen a lawyer, okay, that went as far as 6 cesarean sections, and she's alive and well.
6
cesarean sections. I'm not advising anybody to go for that number of cesarean sections. Please don't get me wrong, okay? Usually when you get to 2-3, we advise you to, yes, but like I said, it's only an advice. Okay?
2-3 safe.
3, okay? Sometimes, in some cases, 4. Usually we'll cancel such people for tubal ligation, bilateral tubal ligation, tying of the tubes, so that subsequently is a form of contraception. Okay. So that subsequently, but it's permanent though, so that subsequently the person will not be able to take in. Okay, because sometimes they do normal contraceptive procedures and it can actually fail. And I've seen a couple of times that it failed in some individuals. So other acquired causes, I will run through them because of our time. Diabetes is there. Celiac disease, I need to talk about this. Non-gastrointestinal symptoms of celiac disease can actually cause infertility, but however, it is reversible. Okay, now in the sense that if you take gluten-free diet, okay, the problem can be solved. Okay, so there are other ones too, but I want to leave some of this acquired so that we can go to genetic. Okay, so among the genetics, we have a number of them, medical names, which I will not bother to bore you with, but I want to mention just one or two of them.
Sorry, sir, Dr. Bart, let's do it this way. I'm just asking. Because of our time is fast spent, I would want us to start genetic fresh next week. So there are some questions I'd like to ask here. One, sir, pain during sex. When a woman is having intercourse and she's experiencing pain, you see some ladies complaining. Most times men normally feel it's a lie, she's enjoying it, but some women really feel that pain. Is it a sign of infertility, sir? And what usually causes that pain?
SThank you very much for that very practical question. Okay, let me look at it this way. Pain during intercourse, during sexual intercourse, doctors refer to it as dyspareunia.
Dyspareunia.
Yes. Okay, so it could be caused by a number of things. Okay, number one, if the woman is not well lubricated before engaging in the act, that could happen. There could be bruises. Okay, so oftentimes we advise people who have challenges with getting wet before getting into the act to actually take some time off to do enough foreplay to actually get them in the mood. Okay, the females will understand more of what I'm talking about. But if in your own case that cannot happen, even after you've done whatever you were asked to do, you can still use some artificial gel. KY gel oftentimes could be of help. I know a number of women who use it from time to who resort to that, and of course they get good. They've been able to have their problem solved. Okay, but beyond that, there could be also some other medical conditions that could give rise to painful sex. Okay, such as endometriosis. I'll break it down.
I know endo has to do with inside from little biology.
Okay, so endometriosis. Now, this condition has to do with when you have the uterine tissue, the uterine epithelial covering that actually should grow within the womb. When you have that growing outside the womb, usually in pelvic organs, so you have a situation where the epithelium that is responsible for menstruation in a woman that ideally should be found within the womb, within the uterus. You have it occurring outside of the womb among the pelvic organs. So when the woman is menstruating, those tissues that are outside are equally menstruating, pushing out blood. But the menstruation in a woman that is coming in a normal way will escape through the vagina. But the one that is occurring within the pelvic organ cannot escape. So what happens? It stays there and inflammation will set in, which of course will lead to adhesions. The adhesions will affect the tubes. The adhesions will affect the surrounding organs and all whatnot. So such people usually experience pains during coital exposure. So they oftentimes could have this pareunia as well. Okay, so endometriosis. You can see that one cannot be broken down in any form.
But you tried by breaking it down.
At this juncture, we have to say a very big thank you. We have to also put or bear in mind that we're actually picking from another
genetic
causes.
And then we go over to causes in line with location.
Yes, like you actually placed a location of the challenges. So on top of that, we want to say a very big thank you